Hi everybody. In continuation, today we're going to be discussing a little bit on treatment of fibroids. How do we handle or treat fibroids when we see them? Number one, I would say it is tailor-made, it is symptom-based, it is goal-based, and it's not always surgical. So not every patient who is diagnosed with fibroids is given the option of surgery as the only treatment option. Sometimes we would do conservative and a wait and watch approach, especially if they are not symptomatic, they are not in wrong locations going towards the cavity, they are not too big, and the patient is probably not even aware of having the fibroid and was just coincidentally diagnosed with fibroids during a checkup. The second option could be something medical. Do we have medical options for fibroids? Are there treatments that can shrink or reduce fibroids? Not sure. Some have been tried. Nothing concrete is available for medical treatment that is known, but sometimes some progestational hormonal medications can be used to slow down the growth of fibroids. GnRH analogs like injection drugs can also be used, but these are probably only temporary measures. They would shrink the uterus, uterine fibroids, by around 30 to 50% of the size, but you cannot use these drugs for longer than 6 months because of its side effects, and therefore after 6 months it's likely to start growing again. The other thing about the medical approach of that nature is that when given GnRH analogs, if for any reason in the future they do require a surgery, the planes around the fibroid become fused with the myometrial wall, and therefore removing these fibroids after GnRH analog use becomes quite challenging. We do have the surgical option, which we have discussed about in a separate video. We have the removal of fibroids called myomectomy, and we have the removal of the uterus, sometimes called hysterectomy, for this. Other treatments could be treatments like HIFU, which is high intensity focused ultrasound, that is available in certain areas of the world, and it is known to also shrink fibroids, but it does have its challenges about the proper selection of patients for this. Uterine fibroid embolization has been used as well, where they target and block the blood supply to these fibroids, but it does come with a few risks about it not completely going away. It would shrink but remain, and sometimes, especially if it is towards the submucous end, it could start degenerating and cause a lot of discharge and other issues. And also the fact that these women might sometimes have risks of going into premature menopause because some blockage of the ovarian vessels or ovarian tissue could be an issue and would lead to earlier menopausal symptoms. We have MRI focused ultrasound as well that has been used, and sometimes there are other complementary and alternative medicines that have also been used to help with fibroid symptoms. So there are a variety of treatment options for fibroids. Thank you.